Hi everybody, I'm Dr. Susan Behnawa here at Rancho Family Medical Group in our Sun City office. We are very fortunate to be able to start offering the COVID vaccine for our patients. So I wanted to give you a little bit of more information about some misconceptions we've been hearing, some questions that our patients are asking, and just general guidelines in terms of getting the vaccine. So I think far and away the first thing I've been hearing from our patients is it safe? Which I think is a completely legitimate question given that it's a very new type of vaccine. And so unequivocally, I can say that for the majority of our patients, yes, getting the COVID vaccine is safe. It's a new type of vaccine. So what it is an mRNA vaccine. There's no actual virus in the vaccine itself. It differs a little bit from other live vaccines that we have, so no actual viral particle. Basically what it is information about what the surface protein on the COVID virus looks like, and your body basically sees the material in the vaccine, reads it, destroys the particle protein from the vaccine, and then mounts an immune response to it. So very safe, very effective. The actual studies of the vaccines were done pretty quickly compared to other vaccines, but nothing was looked over. And so when we talk about vaccine phase trials, usually what's happening is that your vaccine trial is being done sequentially, which means you complete one phase, then you move on to the next phase. Because of the nature of the pandemic, the manufacturers of the COVID vaccines did their vaccine trials simultaneously. So they did multiple phases at the same time, which is incredibly expensive, but completely appropriate given the nature of the COVID pandemic. So the vaccines are based on mRNA technology, which has been around for quite some time. The implementation of the vaccine is very, for us, especially important to get to our patients. We have a limited supply right now, so we're triaging our vaccine supply in terms of how medically complex our patients are. And so if you have heart failure, kidney failure, diabetes, kidney problems, or all of those things, we're trying to get that vaccine for those patients first, and then we'll move on to our healthier patients. We really appreciate you being patient with us as we move to deliver the vaccine. Really important to keep in mind that it's not recommended to get any other vaccines either 2 weeks before or after you receive either dose of your COVID vaccine. So if you do need to do a routine update for your pneumonia or your tetanus, but the COVID vaccine is on the horizon for you, we would recommend deferring that before you get your COVID vaccine. In terms of hearing about people getting sick from the vaccine, so it's really important to make a distinction in terms of adverse side effects that are expected and allergic reactions, which are different from side effects. So we do expect side effects from the COVID vaccine. They can be anywhere from none at all to minimal symptoms, injection soreness at the injection site. We also can see low-grade fevers, some congestion, some body aches, chills. Most of the vaccine side effects, if you do get them, typically resolve by 48 to 72 hours. We don't recommend pre-treating with Advil or Tylenol before you get your vaccine. There's some limited evidence that taking those types of medicines before getting your vaccine may blunt your immune response to it, so we just err on the side of caution. If you are symptomatic after getting your dose and you're about 8 to 12 hours out, you can go ahead and take something to minimize discomfort. A lot of our patients who are vaccinating, we're seeing a more prominent side effect reaction to the second dose. Again, not a cause for concern and not dangerous. We just like to prepare you to maybe schedule an easier day, the day or two after your vaccine, so you can just focus on mounting that important immune response. There have been some concerns that our patients express about whether they're pregnant or in pediatric populations. The nature of the studies that were done, those populations haven't been studied yet, but pediatric studies are underway. We have had individuals who are pregnant get the COVID vaccine, and some of them are participating in studies as well. The American College of Obstetrics and Gynecology does recommend shared decision-making with your obstetrician. So if you are pregnant, talk to your doctor about risks or benefits, and then we'll kind of take things from there. Patients who are on chemotherapy or on immunomodulators should definitely talk to your specialist physician and see when a good time is to actually receive your dose. If you're on certain types of immunosuppressive therapy, you may not mount the appropriate response to the vaccine. Not that it would be harmful, but that you wouldn't mount an effective response to it. So definitely talk to your specialist physician if you are getting treatments. At Rancho, your doctors are here and they're available for you if you have any questions about the vaccine. We do recommend it. It's so important for us to work towards herd immunity, to getting some semblance of normalcy back in our lives. So we're here in Sun City setting up our vaccine clinics. Please reach out if you have any questions or concerns. Again, I'm Dr. Susan Behnawa here in our Sun City office with Rancho Family Medical Group.